You asked, I'm answering. What's the difference between a deep plane facelift, a SMAS facelift, and a mini lift? And which one's best for you? I'm going to use this highly abstract teaching model to show you in the clearest way possible what the differences are so that when you've finished this video, you will understand them extremely clearly. So the first thing we need to do is say, what exactly is a facelift? To a plastic surgeon, a facelift treats the lower half of the face, jawline, maybe a little bit of the neck. A brow lift treats the brow. Blepharoplasties treat the eyelids. A neck lift treats the neck, earlobe reductions, lip lifts, little side dishes like that. But a facelift is about the jawline and the cheek. Okay, so when you say a full facelift, what you're really saying is brow lift, eyelids, etc., etc., etc. When you say deep plane facelift versus SMAS facelift versus mini lift, all those procedures are addressed solely at about the lower half of the face. So in this teaching model, I have the skin represented by the tan layer, I have the fat represented by the yellow layer, and the superficial muscular aponeurotic system, also known as the SMAS, represented by this red layer. All facelifts work on the lateral side of the face, the cheek area, in these layers. And although there are countless variations of facelifts with generic names, trademark names, specialized names, surgeons' names, they only all work on these same structures. So let me show you how they fall into three basic families. So the first family is a mini lift. And what's a mini lift versus a regular facelift? It's kind of like the difference between a snack and a meal. There is no clear boundary where a snack stops and a meal begins. One man's snack might be someone else's full dinner. Well, the same could be said with a mini lift. So in general, a mini lift implies shorter incisions, dissecting or separating the superficial layer to a limited degree, because dissecting or separating the skin and fat layer up off of the muscle layer, that's not a natural plane. It's not an avascular plane. You have to do sharp dissection to do that. That comes along with bruising and swelling. So we limit that. And it also implies a quicker recovery because of this limited dissection. So with the average mini lift, what's happening, the incision is towards the ear. And on this model, we already talked about the skin, the fat, and the SMAS. This represents the nasolabial fullness down to the jowl fullness, down here by the jawline, okay? The black line in here, this represents the nasolabial fold. So in a mini lift, what's happening is the incision is made by the ear, a limited amount of undermining is performed, and then way back here by the ear, either the skin itself is pulled to get some improvement. Now, one thing you can already see happening, when I pull on the skin, there are weird strain lines that form in the skin. And this is when you see that the outside layer looks tight and strange looking and sweeps in the skin. This is like a 1970s, 1980s kind of facelift, and that's called a skin mini facelift. And almost nobody does that anymore. More commonly, what's done, little bit of skin undermining, and then the SMAS layer is tightened. And when you tighten the SMAS layer, you can see we're getting some motion of the bottom part of the jowl down towards the jawline. Very limited motion up here, but some motion down low. And then we take the skin, trim the excess where it's overlapped, and all the tension is borne on the SMAS layer. So that's a mini lift. So if that's a mini lift, is that a good option for you? Well, the mini lift comes with limited recovery, limited downtime, but it also has very limited results, and it has limited durability. The reason the durability is so limited is when you do all your tightening from back here, way by the ear, all of this intervening tissue has the opportunity to stretch out. And remember, our targets are all the way up at the front of the face. And so as intervening tissue stretches out, the targets at the front of the face fail very early. So a mini lift is good because it's quick and easy. When I first started in practice, I did mini facelifts. I did them in my office under local anesthesia with just a little pill or two to help people calm down. And that's a very good procedure for a beginning surgeon, a patient with very basic expectations. But honestly, these days, patients' expectations are super high. You are seeing the best of the best world-class results on your Instagram feed, and you're not going to be happy with the results generated by a mini facelift right away. And certainly over 3, 6, 12 months, the final result, it's not going to look like what you're seeing on your Instagram feed. And honestly, I don't do many facelifts anymore because I think they would hurt my current reputation. So what's the next kind of facelift? The next kind of facelift is a SMAS facelift. And in a SMAS facelift, the family of lifts called SMAS facelifts, the incision is made by the ear, the skin and fat layer is elevated further up off the SMAS layer. This is a bigger dissection, more bruising, more swelling, more downtime. Why would you do that? Well, because now we can take this and bring our tightening much closer to the target and get much more impact on the jowl, especially down here at the jawline, some impact towards the midface. And now look how much excess skin is generated over here by the ear. Tons. So we've borne all the tension on the SMAS, much bigger impact on the jowl, no tension on the skin ideally, much better lift because the power is brought much more close to the target instead of being way back here. Now, I still will sometimes do a SMAS facelift. I do a SMAS facelift in the kind of person that has coarse wrinkles in their overlying skin. And in persons that have coarse wrinkles in their overlying skin, when we undermine this and help all that accordianing come out, it improves coarse cheek wrinkles in a way that lasers cannot do. And so I like SMAS facelift sometimes where totally freeing up the skin from the undersurface would help that patient, usually coarse wrinkles. I also like SMAS facelifts in patients where the muscle layer isn't so hot. Either it's been operated on 2 or 3 times, or it's just real flimsy and terrible. In those patients, trying to elevate this is with a deep plane I'm going to tell you about next. It's risky and dangerous. I would rather just do a SMAS facelift. So the SMAS facelift, by the way, comes in 2 types. There's a plication, where the excess is folded onto itself and sewn down. And then there's an imbrication, where the SMAS excess is cut out like that, and this excess is literally taken out and a seam is formed. They're similarly powerful. They're both very safe overall, and they generate moderate power at the jowl especially. So the next kind of facelift is what I do most of the time, and it's called a deep plane facelift. And what's a deep plane facelift? Well, we elevate the skin and fat to a limited degree. We're not elevating all the way out here. We then take the muscular layer and actually release the muscular layer, or the SMAS, the superficial muscular aponeurotic system. We release that and then free up and undermine the SMAS. And then we use that freed up and undermined SMAS to carry the face. The skin is still attached. There's limited dissection up here, but we get onto this natural plane and undermine it. Now the trick is, when you undermine that natural plane, you are right over a thin, flimsy, wispy layer where the facial nerve branches run. The facial nerve is the nerve that moves your actual mouth and eyes and smile. It's an incredibly important series of nerves. If only these layers were so clear in surgery. They are not. It can be very difficult to know when you've made it all the way through the SMAS layer. It can be very difficult to not violate this thin, wispy, transparent parotito-mesenteric fascia. It can be very difficult to tell if what little wispy strand you're looking at is a nerve branch or a little fibrous tissue or what that is. If this area bruises during the injection, or if the patient is oozing during surgery, the colors aren't right, everything's kind of purple-red, this is a very difficult and demanding dissection to do. And the deep plane facelift, while it's more powerful, generates less skin undermining and gives us a much better way to bear tension on the SMAS, is best left for expert surgeons. Some of you have been wondering, now what's up with these push pins? How come all the motion is happening up here at the jowl and none of it's happening up towards the nasolabial fold? Well, these push pins, these straight pins, represent the facial retaining ligaments. And so there are 4 major sets. There's the zygomatic ligament, the mesenteric ligaments, the mandibular ligament, and the cervical retaining ligament. These ligaments if we can remove them, or better said, transect them, release them, when we do that, all of a sudden our deep plane lift has tremendously increased power. Has increased power at the jawline, and it has increased power at the malar cheek, the mid-face region. So if we release these restraining or retaining ligaments, is what they're technically called, suddenly we have passive, beautiful motion of the face. Really treats the redundancy in this area. So why doesn't everybody release them, even in a deep plane lift? Well, releasing those is known as an extended deep plane facelift. It requires dissection of this really hairy, risky plane. It's not risky, but it's difficult plane, all the way forward in the face, where even expert surgeons get really nervous. And so the difference between a deep plane facelift and an extended deep plane facelift is, are these ligaments completely released, allowing for free, passive, easy motion to restore the face. The face then scars down. Scar is a good word in this context. It heals down tightly into its new location. This is overlapped, a beautiful healing. And in doing so, there's no further need for those ligaments. They're actually in your way. There's no harm in having them released. The face heals very tightly into its new position, and it's effortless. If you notice, this is just sitting here passively, like no problem. And look at all the skin that is overlapping the old incision line and even overlapping the ear. This really happens during surgery. So at this point, all we need to do, sew the edge together to hold it there, trim the excess skin in a tension-free way. That's an extended deep plane facelift. Now, even the extended deep plane facelift, if we look at this, the surface of the skin, if it is stained or wrinkled, this stained, wrinkled skin is just coming along for the ride. To treat the staining and wrinkling of the skin, you need to dry clean it or iron it. What's that? Skincare and laser resurfacing. So we do a lot of laser resurfacing at the same time as deep plane facelifting. So the pluses of a deep plane facelift, especially an extended deep plane, tremendously improved mobility of the face. The minus, it is extremely difficult to do well. And if you do it poorly, you can have nerve injuries, which can make you look really bad. Hopefully they'll resolve. They usually do, but not always. This is where tigers fear. This is tiger territory. This is where angels fear to tread. So I hope that was a helpful description of the differences between those. I should say today is May 10th, 2021 that I'm filming this video. This is how I feel about facelifting surgery today. 5 years ago, my approach was different than it is today. I'm really hoping that 5 years from now, my approach will be different. So if you're at home watching this video and it's 2026 and you're about to come see me for a consultation, and I recommend something different or say something different, it's because my beliefs continue to evolve as my experience continues to grow and as the field continues to expand and we understand anatomy better. So I hope that was helpful. If you have any questions, please put them below. I would appreciate it if you liked it and commented it and shared, get this video out in front of people, because I think it is the single best description, the most clear description of surgery to aging face that I can even conceive for lay people. Thank you so much.